Namaste. This is Dr. Raghavendra. I'm the Director of Central Council for Research in Yoga and Naturopathy, Ministry of AYUSH, Government of India. Good evening, everybody, and welcome to this dialogue on yoga for cancer. I'm thankful to Society for Integrative Oncology for agreeing on such a short notice to participate in this Indo-US dialogue on yoga for cancer. It is heartening to see a lot of medical oncologists, yoga therapists, cancer physicians, and other people who are involved in the care of cancer patients assembling here and congregating in this particular webinar. We have about 15 participants in this particular webinar, and we'll be deliberating on the nuances of cancer care, how we are integrating yoga in cancer care, what are the potential issues, the challenges and opportunities involved in integrating yoga for cancer care. I thank you all for being a part of this deliberations, and I hope going forward we'll have some beautiful insights into the care of cancer patients, integrating yoga into their care by eminent speakers like Dr. Lorenzo Cohen, Dr. Santosh Rao, Lee Liebel, and others as well. I thank you all for being here. We will start the proceedings, and before we start the proceedings, we would like to just give an overview of what this World Cancer Day is all about. This year, the theme of the World Cancer Day is basically on I am and I will. It is mainly on the cancer survivors. It is giving a hope to the survivors that they're going to conquer cancer, they're going to stay a step ahead of cancer. And we, as cancer caregivers, our duty is to help in enforcing this particular belief and also do everything possible wherein we can improve their quality of life and we can give them hope to win over cancer. With this, we'll begin the deliberations today. Thank you so much for being here. Over to Lee Diebel.
Namaskar. My name is Lee Leibel. I am a certified yoga therapist who works at the Columbia University Medical Center Comprehensive Cancer Center in New York City. I work in the Division of Hematology Oncology. My yoga training is from S. Vyasa University in Bangalore. I hold the Master of Science degree in yoga therapy. I work with cancer patients across the care continuum from diagnosis through treatment, survivorship, living with chronic disease, metastases or recurrence, all the way to end of life. Yoga is a beautiful mind-body science that can accompany the cancer patient along every stage of the cancer journey and help manage side effects such as fatigue, depression, anxiety, mood disorder, pain, nausea, sleep disorders, peripheral neuropathy, and overall improves the quality of life of people with the cancer diagnosis, as well as their caregivers. Thank you.
Thank you, Dr. Raghavendra. Thank you for organizing this very important meeting. And today, this is in recognition of World Cancer Day 2021. And so we're very happy to contribute to that. And we say hello to our friends in India at AYUSH and CCRYN. The Society for International Oncology is a multidisciplinary professional organization whose mission is to advance evidence-based integrative practices to improve the lives of people affected by cancer. And we here today on Zoom are many members of the Yoga Special Interest Group for the Society. And we are excited to share some of our ideas about yoga and oncology, and hopefully this will be the beginning of a collaboration and partnership with our friends in India. And we thank you so much for sharing the gift of yoga in the United States. So I want to begin by introducing the people that are on the Zoom call. And I'm going to start with Dr. Lorenzo Cohen, who is our co-chair and advisor of the Yoga Special Interest Group. Dr. Cohen, if you would just take just a minute to introduce yourself and
Sure, thank you. Thrilled to be here today to be able to have a discussion around yoga and cancer. My name is Lorenzo Cohen, and I'm director of the Integrative Medicine program at the MD Anderson Cancer Center. This is a large cancer center in Houston, Texas, where I've been directing this program, doing research in particular in the area of yoga and other mind-body practices for over 20 years now. You know, I think as we'll talk about today, yoga is one of those practices, along with other integrative modalities, that needs to be integrated alongside conventional care as the standard of care.
thank you, Dr. Cohen. Smita, you want to go next?
Sure. Thank you, Lee. Namaste, everyone. Very happy and excited to be here. My name is Smita Malaya. I work as a senior yoga therapist, a mind-body interventionist at the Integrative Medicine program at MD Anderson Cancer Center, where I've been fortunate to be mentored under Dr. Lorenzo Cohen. I received my training from SVIASA, Bengaluru, and for the 10 years past, I'm at MD Anderson, but being a yoga therapist for close to about 16, 18 years now. Glad to be here.
Thank you, Smita. Dr. Bethel Kelly.
Hi everyone, I'm Kelly Bethel. I am currently the clinical director at the University of Maryland School of Medicine Center for Integrative Medicine. We provide services in the Stoller Outpatient Clinic. I am a certified yoga therapist and also hold a doctorate of physical therapy.
Thank you, Kelly. Bina.
Hi, everyone. Thank you again for having me. My name is Bina Patel. I am currently a physician assistant in oncology, but I also have a yoga for cancer training so that I could pursue teaching yoga to some of my cancer patients. And yeah, I think yoga is incredible, and it's definitely helped a lot of patients with different symptoms. And I think the way that we're headed is that a lot more patients are becoming interested in a lot of mind-body techniques and asking about yoga and other practices. So I'm happy to share any input today. Thank you.
Thanks, Bina. Suvina.
Hi, my name is Savina Guglani, and I'm a medical physicist / yoga therapist in Houston, Texas. I do practice like Dina, yoga therapy with my patients when I meet with them and work with them. And I find some of the mind-body techniques that we use, especially breathing techniques, really are helpful in terms of managing some of their symptom-related issues that they might have, which we will talk about today. So nice to be here. Thanks, Lee, for the invite.
Thank you, Suvina. Sunmay.
Hi, my name is Sunmay Mukhopadhyay. I almost forgot how to pronounce my last name. But I'm in Los Angeles. I've been with the County of Los Angeles. Actually, I was the CI of their Department of Health Services. I have been trying to integrate at least, not I wouldn't say totally integrating, but trying to integrate yoga into various phases of the disease, from early diagnostic phases to late stage. I'm associated with several nonprofits in this area, helping more than a therapist, as a healing, as a person, as a last right counselor. So at different phases of a cancer patient, early diagnostics, interception, to all the way to the last phases of a heavily metastasized condition, including the passing away. So that's my role, more as a counselor, of course, all the techniques we use, different techniques for different types and at different stages. And that's about it. I'm happy to be here. Thanks, Lee and Dr. Rao for arranging this.
Thank you, Sunmay. Anne.
Good morning from Canada. I'm Ann Pittman. I'm a certified yoga therapist and research consultant at the Ottawa Integrative Cancer Center and the director of the School of Embodied Yoga Therapy. So working on a team, an integrative team here from diagnosis and actually doing quite a lot of work with yoga therapy at the end of life as well. Thank you.
Thank you, Anne. Tanya?
Hi, Lee. Thank you. Thank you, Dr. Rao. My name is Tanya Culp. I'm a certified yoga therapist. I'm here in Philadelphia, and I am employed with the Children's Hospital of Philadelphia. Our integrative medicine program is working in conjunction with our integrative oncology program, and we work from diagnosis through end-of-life care, inpatient, outpatient, and still providing some telehealth. Primarily focused, I would say, on, or trying to focus a little bit more on the older adolescent population, but still working across the age continuum.
Okay, thank you, Tanya. Doreen.
Hi, thanks, Lee. My name is Doreen Stein-Cerusi. I'm with Lineberger Comprehensive Cancer Center, which is part of the University of North Carolina. And I've been working with cancer survivors for almost 17 years. And I've done the range from newly diagnosed, right before starting radiation, outpatient, working a lot with helping people get through treatment and important meetings right now, you know, because it's all virtual. And starting next week, I'll be in the hospital, back in the hospital doing inpatient yoga therapy for cancer patients there. So I'm looking forward to that beginning and a little bit of normalcy from COVID. I'm excited for that. Thank you. Looking forward to it.
Thank you, Doreen. Nancy.
Thanks, Lee. I'm Nancy Sinton. I'm a certified yoga therapist in the Integrative Medicine Department of the Orlando Health Cancer Institute in Orlando, Florida, working with teaching yoga to cancer patients as well as a research project.
Thank you, Nancy. Sandra?
Hi, good morning, everyone. Thank you, Lee. Thank you, Dr. Rao. This gathering for me has been a long time coming. My name is Sandra Gilbert. I'm in Nashville, Tennessee, and I currently work at Vanderbilt University School of Nursing, where I work on a team with research in yoga for breast cancer survivors, and our current project, which is yoga for children with cancer and their parents. And we did have to go all virtual. I'm also the director of YCAT, which is yoga therapy in cancer and chronic illness, where I train teachers and yoga therapists to work safely with people with cancer. And I've been in this field for using yoga as a therapeutic modality for 20 years, and specifically in oncology for 19 years. And so I'm really excited to be here and be a part of this discussion in our future. Thank you.
Thanks for joining, Sandra. And last but not least, Tina, right in the middle of my screen.
Good morning. Thank you. I'm Tina Walter. I am in Cincinnati, Ohio. I'm a certified yoga therapist, and I trained with Yanni Chapman. And that was a long time ago. But for the last 10 years, I've been providing inpatient and outpatient yoga therapy interventions at 3 different hospitals in Cincinnati. I subcontract. One is the University of Cincinnati. They have a rather large integrative department. The other 2 hospitals really don't. I also teach classes for the cancer support community, and I'm very honored to be able to teach yoga, this beautiful practice. I hear daily from my students and my patients how much this practice helps them during their cancer journey. Thank you.
Thank you, Tina. And also Dr. Santosh Rao, who is our co-chair of the Yoga Special Interest Group, could not make the meeting this morning because he's in clinic with patients, but he sends his regards. He is a medical oncologist at Banner Health MD Anderson in Arizona. And my name is Lee Leibel. I'm in New York City. I am at Columbia University Medical Center at the Herbert Irving Comprehensive Cancer Center. And I have my yoga training from SVASA in Bangalore. I have the Master of Science. And so I'm excited to bring the best of the East to the best of the West. So let's get started with this. We have some questions that Dr. Raghavendra has asked, and I'm just going to say a few words to start. So when we're working with the cancer population with yoga, we know that there is a continuum of care. It starts at the diagnosis, then it goes through treatment, and the treatment could be surgery, chemotherapy, radiation, hormone therapy, immunotherapy, targeted therapy, or a stem cell transplant. And then we have the next phase, post-treatment, which could be cure remission, or it could be living with chronic disease, where cancer is managed just as a diabetes or a cardiovascular disease would be managed. Then we have recurrence, when the cancer is treated and it comes back. And then we have end of life. And we recognize that yoga and yoga therapy has efficacy and application for every single stage of this cancer care continuum. And the yoga can be delivered in so many different locations: in the hospital at the bedside, in the chemotherapy suite. It can be as part of the experience in the hospital while you're waiting for your appointments. It can be in a special room or an auditorium after hours. It can also be delivered in the community. So our most important concern is accessibility. How do we bring the gift of yoga and all of its benefits to every person who is affected by cancer? And how do we do that safely? We know that cancer it's so many different diseases, and these diseases affect different body parts. The treatments for the disease affect the body parts. And we must know about the progression of the disease, the impact of the treatments, and how we can keep our patients safe within our yoga practice. So the themes that keep coming up with our group are, of course, the accessibility. How do we provide it in hospitals and in communities? How do we get funding? How is it paid for? In the United States, there are basically three models. One would be that the hospital or the healthcare system pays for it. The second would be that the patients pay for it. And the third is philanthropic money or grant money that would pay for this yoga intervention. We also know that many cancer patients have comorbid conditions. They are often a medically fragile population. This could be diabetes, cardiovascular, arthritis, osteoporosis, along with all of the mental health issues. So how do we as yoga therapists and yoga professionals deliver this safe and effective intervention to our patients, mind, body, and spirit? Because we all know yoga was developed 5,000 years ago to end suffering. And so what more beautiful way to help a person affected by cancer have a better quality of life through their treatment experience. Of course, COVID has influenced us. We've gone from inpatient to virtual delivery, and there are challenges there. And the misconception about what is yoga. You know, in America, many people think it's the physical practice. So we really need to create awareness, not only for the general public and our patients, but also for our doctors and our nurses to understand it's much more than just, you know, the asana.
Thrilled to start to hear, you know, all this information, in particular from the yoga therapist, because of course that's what matters, you know, what is really going on in the clinics and the hospital rooms. When it comes to the decision makers, of course, they will look at a number of things, not the least of which is, you know, how do we pay for this? But importantly, they're going to look to the evidence. And there's still some people who are, you know, you could say at best on the fence about, you know, the importance of yoga. And I thought I would just share a little bit about what that evidence is that exists today, in some sense what's missing and where we need to go. So this is a review that Suzanne Danhauer first authored with a number of other yoga researchers, including myself, that did a systematic review of yoga in oncology, both for patients who are undergoing active treatment as well as into survivorship. And what we know when you look at the literature, in particular, even of randomized clinical trials, is this very steep increase in the number of trials that are being done. And you can see that just 3 years ago, there was over 60 clinical trials completed in 1 year. And, you know, this is increasing year after year. And the evidence is, you know, very strong that yoga has an impact on overall quality of life, physical aspects of well-being, both of objective as well as more subjective measures, and importantly, benefits biological outcomes, things like lowering stress hormones, some research showing improvement in immune functioning. So, you know, yes, it's important to improve cancer patients' quality of life, and that's where the evidence is actually quite overwhelming, as I'll show you in a moment. But having an impact all the way into the tumor microenvironment is critically important as well. And we know that chronic stress in particular is a prognostic indicator of worse survival. And we understand the mechanisms whereby chronic stress leads to inflammation, decrease in cell-mediated immunity, over flooding of the body with stress hormones that innervate the tumor microenvironment. And so this is a critical antidote, you could say, and an adjuvant treatment that really needs to go alongside conventional care. Now, are there other mind-body practices that have these similar effects? Of course there are, from multiple traditions, but yoga, as I've written about, is really a quintessential mind-body practice that includes both the physical aspects as well as the psychological and calming aspects. And as others have noted, this can be titrated for different times in the cancer care continuum to meet individual patient needs. Now, in the United States, you know, there's a number of different organizations that we would follow in terms of guidelines for, you know, what should be done with cancer patients. And one of the organizations is the National Comprehensive Cancer Network, which is made up of I think there's over 50 comprehensive cancer centers like MD Anderson, the Harvard Group, Stanford, etc. Many people on this call are part of comprehensive cancer centers, and it is people who come together, the experts from these organizations. They look at the literature and then they come up with what are the guidelines for helping to manage breast cancer, prostate cancer, and in this case, symptoms. And here we see that yoga is listed on the cancer care guidelines, meaning that this is something that should be recommended to patients and ideally provided to patients through our system for anticipatory nausea and vomiting. And you see here some other behavioral therapies like relaxation, hypnosis, relaxation exercises. But this is the first time in 2019 that yoga is listed on the NCCN guidelines for nausea. Next, we see fatigue, again, new to the guideline. We see yoga listed at category 1. Similarly, for cancer-related pain, different behavioral strategies, but the evidence isn't quite as strong as it is for fatigue and nausea. So the statement that the guideline makes is consider yoga for improving some of these survivorship areas because there is evidence. Now, the strength of the evidence isn't as robust as nausea and fatigue. And one of the limitations in the area of yoga and in cancer care is we don't have these multiple large-scale multi-center clinical trials. Another set of guidelines that came from the Society for Integrative Oncology, of which we, of course, are members, but more importantly than what we said was the endorsement from the American Society of Clinical Oncology, ASCO, which is really the authoritative oncology organization. You know, really people look on that from around the world. And there it was pretty clear that, you know, again, a number of behavioral strategies, but yoga for anxiety, for mood, for overall quality of life. And, you know, the recommendations here being quite clear for a number of these symptoms. So the real challenge here, you know, yes, we should do more research, and in particular, as I mentioned, multi-center and ideally multi-country international trials, both, you know, following fixed protocols for certain symptoms, but also something that we can do now that you know, we've been forced to do is being able to do virtual-based yoga using Zoom-based platforms that is allowing yoga to actually be more accessible than it ever was before. It's not necessarily easy for people in rural communities to come into the center 2 or 3 times a week to receive their yoga care. So we can literally beam into their homes. For those who say, you know, in your institutions that there isn't a lot of evidence for the role of yoga in cancer or for other diseases for that matter, I would recommend this book that we're going to be putting into a second edition in 2022. You see on the right the edition that's available in India for a much reduced price to the UK version. And there was so much evidence on the role of yoga in cancer care that we actually needed 2 chapters out of the 17 medical chapters, one for during treatment and the other for cancer survivors. But there is, you know, evidence for yoga for cardiovascular disease, for women's health, for neurological conditions, 17 different medical conditions listed in this book. And our cancer patients, of course, have that one disease, but the majority have other chronic diseases because, of course, cancer predominantly is a lifestyle disease, and many other comorbid conditions are coming along for the ride. So, you know, this is the diagnosis of cancer, a teachable moment, and yoga is going to help them for getting through their cancer care and thriving during and after. But it's also going to be an important practice to help them in managing many other chronic conditions, and ideally preventing in the first place, and going beyond yoga as asana, pranayama, and meditation, and really yoga as a way of life in terms of diet, in terms of sleep habits, exercise, very importantly, how we manage stress and how we interact with ourselves, each other, and the world as a whole. So with that, I will stop and pass it back to Lee.
Thank you, Dr. Cohen. And actually, the book is on my desk. So I do recommend it very highly. As Dr. Cohen said, there are 2 chapters on yoga and cancer and lots of good research. And 15, we've been going an hour and 15 minutes. We have 3 yoga therapists. What would you like to do? Would you like to do a wrap up and next steps, or would you like to spend time hearing more?
I think let's wrap up. So I would just like to, before we even wrap up, we were just thinking about what are the things which can be done with AYUSH collaborating with SIO or vice versa. So that is one aspect. Before I go into this, just to tell, I'm very happy and to hear a lot of thoughts and thought processes from various yoga therapists, oncologists, doctors who are involved in the care of cancer patients. And a lot of thought processes are going on, and I'm sure in days to come, we'll devise means and methods to improve the care of cancer patients in your country. What is important today, based on all the topics which we have discussed today, is to look at how do we enhance awareness about yoga. I think most of you also put it very rightly that we need to really bring awareness about yoga, educate the doctors, educate the oncologists, educate the fence sitters on various aspects of yoga. So how do you do about it? What should be the steps taken? So we need to formulate certain programs, awareness programs, education programs, probably have more webinars and even conferences as well, wherein we can take the message of yoga to the oncology community. Second thing is we also have to develop practices and modules which are very simple and easy on patients because yoga is something which is to talk about calming of the mind. It doesn't require always a movement. It just requires awareness on the breath and control of the breath also. And we need to try to, we can achieve the same outcomes, simple practices for these patients which are easy on these patients without doing all the dynamic postures or movement therapies, etc. Third thing is we need to use technology platforms for delivery without any trade-off on the personal touch. So we need to see how to make this happen. For example, if you're going to be using a Zoom platform for delivering the yoga intervention and post this delivery of the yoga intervention, how do you connect with the patient without even because when you do a one-to-one session with the patient physically present, it's a different thing altogether when you do it on a virtual platform. So how to bring that connect with the patient when you do an online platform, that is also very, very important because you need to see whether when you say the patient to become aware of the breath, relax and to do all those things, whether it's really relaxing or not, you'll not be able to find out. Okay, because when the patient is there in front of you and when he's doing a shavasana, when you're observing him very keenly, you can get all the cues. You can feel the body cues and know how much attention the patient is paying to your instructions, and you can really gauge the patient's attention span and this capability in going up in the practice. But does not happen in an online scenario. So can we develop tools to measure relaxation response online? So there are again some of the innovative things which we can do. We can develop a smart. We have developed a smart yoga mat here, which we are validating in COVID patients now in India. Okay. So the fourth one was to develop training programs and courses which can be endorsed by Ministry of AYUSH, especially for yoga therapists in oncology. So working with cancer centers, and that will go a very long way. If all the experts come together, we develop a very nice concise booklet only on oncology and yoga therapy aspects of care for different management of various symptoms in cancer patients. That will really be wonderful because it helps in setting up standards. It helps in setting up uniformity of care across the world. And that will be, it doesn't matter which school of yoga, you have the principles for management of each symptom. And that could be one of the important steps which we can take together. And last one is also to develop international collaborative studies. And Dr. Lorenzo was talking about today morning. Why don't we look at developing a online yoga module and online yoga intervention for patients, and let us validate and test those kind of process. And we are welcome to do that. I think let us put up study together and see how this can be funded and how to take it up forward in a large scale in both US as well as India. So I thank Lee. I thank all the people who are experts who are here who have spent their valuable time, who have spent their valuable information and expertise, for sharing their expertise with all of us here. And also thank Dr. Lorenzo for his everlasting support. He's always there whenever I call him. He's very obliging. And thank you, Dr. Lorenzo, for having spent your precious time. And it's a wonderful session to insight into the evidence level for yoga. It's very heartening to see that yoga has got into the ambit of guidelines now. So that's a very, very heartening news. And this is what should happen. We have to convert these, we have to do good amount of research and develop good hard evidence, good level 1 evidence, so that these can go into guidelines. And once they go into practice guidelines, they also get insured and they also get paid for. And that is when you would have this yoga therapy sustaining. And I think that's really the way to go. I'm sure with the kind of research which all of you are putting in, the energies you're putting in, I'm sure this is going to happen in a few years' time. And I wish you all the best. And thank you all for being here. Thank you so much, Lee. And thank you, Lorenzo, and all your colleagues. Thank you so much. Namaskar.
Thank you, Dr. Raghavendra, very much.
Thank you all for this insightful deliberations in the last 1.5 hours. This has been a very, very important scientific deliberations, which we have seen of very high caliber, where you have shared all your experiences with cancer patients, the problems you really face in dealing with cancer patients, the support you need to really improve the service to these cancer patients. And we probably would also try to do all this possible in the near future by developing joint training programs for caregivers to deal with cancer patients using yoga-based approaches. Society for Integrative Oncology and CCRYN will probably work together in developing such training programs and also developing the curriculum framework as well as guidelines for using yoga therapy, integrating yoga therapy in cancer. I thank you all for being a part of this particular webinar and this initiative.